To today's presentation on transparency and getting the most for your healthcare dollars. You can see up here we had 2 quick surveys while people were waiting about whether you've ever shopped for physician visits costs, as well as if you've ever compared costs of x-rays and if you knew how to do it. And we definitely do not have people that are out there shopping their health insurance costs every time. So hopefully by the end of this presentation, we can really inform you guys and you'll have some more tools to shop all of your healthcare services. With that in mind, today's presenter is me, Carrie Millar, the FDA Services Membership Service Manager, as well as Scott Roostrom is with me. He is the FDA Services Chief Operating Officer. And I'm going to go ahead and pull up the presentation. We are going to be going from a PowerPoint to live web examples as well. So just bear with us a little bit as we transition back and forth, but we've practiced this quite a few times, so it should be pretty easy. But with that, I'm going to go ahead and turn this over to Scott Roostrom, who's going to start us out a little bit about what we're going to cover today.
Thanks, Carrie. Also want to welcome everybody to today's webinar. We're going to cover the several topics today. The presentation topics today will be cost comparison tools, and what these are basically essential when contemplating the cost of expected care. These are available through public free websites that are consumer conscious, as well as the major carriers also offer these types of consumer tools. We're going to give you a couple examples a little bit later with Aetna and Florida Blue. We'll go over quality of care tools. And what these are designed to make sure that the physician or the hospital facility that you are about to see delivers the superior care you want, or whether there is another alternative that might be better for you. We'll also go over teledoc and e-visits and other discounts available. Cost of care. We want you to become a smart shopper of healthcare delivery and know what your expected costs are before you seek treatment. So we shop for our health insurance. We try to find out the lowest premium plan, but we hardly take into account what our medical expenses are going to be and what our out-of-pocket expenses are going to be. So in some of the examples Carrie's going to be showing us, you'll see how these transparency tools really can save you significant out-of-pocket expenses. So there's many resources available to us to make sure that you're seeing the right facility for your treatment. So we want to make sure that you're accessing the best physician or hospital for your specific treatment needs. Before we go on, I want to go over some definitions to make sure we're on the same page with some of the vernacular. Cost of care, those are the out-of-pocket expenses to the consumer. So this includes your copay and anything not covered by the copay or your deductible. Quality of care, these are the ratings based on the frequency of treatment, complications, length of hospital visits, any other complaints. And this stuff is compiled in databases that these insurance companies provide to you as a tool to research the kind of physician or the facility you're going to seek care. Negotiated rate is simply the rate the insurance company pays for specific treatment at a facility. This rate can vary from procedure to procedure and also across facilities. Ancillary products are those non-medical insurance services, dental, vision, life, gym memberships, etc. like that. E-visits, health advice given by a registered nurse or physician over the internet. This will become more and more popular as we go forward with Obamacare. Teledoc, same, it's also health advice by a physician over the telephone. And then lastly is low-cost health plans, either the high deductible or the high co-insurance health plans that have a greater out-of-pocket expense to the consumer.
Yes, and when we're talking about the low-cost health insurance plans, a lot of times those low-cost plans, especially when we get into the Affordable Care Act, will have higher deductibles, and so you're going to see that you're going to have to be paying out of hand earlier until those deductibles are met, especially in the bronze and silver plans on the exchange. So we wanted to make sure everybody knew that there are a lot of cost of care comparison tools out there to look at different things. So one of the public sites that is really great to use is the healthcarebluebook.com. And what this one does is it will allow you to put in your zip code and then look up a specific treatment or x-ray or scan or whatever you are currently looking for and see what the cost should be in your area. So this is kind of a general tool to see what the negotiated rates are. So if you are looking at having some type of surgery, I mean, obviously if it's an emergency, it's a different case situation. So this is going to be more of when you know that you have something coming up and you want to know if it's cheaper to have it done in your area, or maybe it makes more sense to go even 20, 30, 40 minutes up the road to have it done somewhere else. So this is one website. Another one public site that you can use. But as we talked about earlier, United Healthcare and Cigna and Aetna and Florida Blue and several other major health insurance carriers have their own transparency tools available, and they allow their members to access these through their websites to look up the cost of care. So we're going to go ahead and actually switch over to the Aetna website for Aetna consumers. And right in the middle of the page, they have a cost of care button, and it allows you to put in which member who's on the plan, and then it allows you to put in a zip code, and then the type of service that you're going to be see. So let's say we had a chest contrast with dye, a CT scan, which is something that is normally not done on an emergency basis. And let's say you went to your doctor's office and they said, oh, you know, we really want you to go get a CT scan. So you can either go to the website. Several of the insurance companies have 800 numbers. So it allows you to put in what you're looking for. You can do this on your mobile phone, this live demonstration, and also the presentation. So again, I'm sorry this is taking a little bit longer, but here we can see a list of different facilities, and it's not giving me the address and the mileage. It will if you are an individual that has a plan. This is because this is a demo. It's not telling me the specific provider. But if you look and see, there's different facilities, the MRI center, a radiology center, and as we scroll down, the cost definitely goes up. So the same CT scan done at a hospital is drastically different in price than done at a radiology center. And we can open up this cost details, and it will tell you how close the facility is to you as far as the zip code that you entered, and you can search within a certain radius so that you don't want to have to go miles and miles away to get something cheaper. But you see here that the cost of service is normally $2,188, and Aetna has a negotiated rate, which is the rate that they have negotiated with this specific radiology center, at $325.55. So even if you have a very high deductible plan, your out-of-pocket would only be the $325.55 because that's the negotiated rate. Now, in this situation, they have an HRA in account, so the HRA would then pick up a portion of their fees, and the out-of-pocket would be less. But this $325.55 is what the negotiated rate is. However, you'll see that when we were looking at some of the more expensive options like the short-term hospital, their negotiated rate is $552.82. So you can see by just going onto this website, the negotiated rate is much different from the radiology center to the short-term hospital. So your physician might say, here, go across the street and get a CT scan, and by just looking on this website, you can look up the cost of something different. And this is Aetna's version of it. However, Blue Cross Blue Shield has a very similar one that's located in the middle of their page. It's a compare medical costs tool. And again, they're going to make you say these are just estimates and everything's different. But let's say, you know, we came down here and we looked for, let's say your son broke his foot and you needed to get an x-ray to see if it's broken or you just need a cast. You just put in the provider and the distance that you're willing to go. And it again, this one is giving you specific hospitals, but you can say, okay, this is the cost of what it's going to be at the university, and this is what it's going to be at this hospital. So we can look at the different facilities, and it has the mileage, and you can compare cost and quality. So when you pick 2 or 3 it tells you what your total cost is going to be. So it's the allowed amount. So you can see at the Seminole Hospital, Florida Blue has negotiated $62 as the x-ray, whereas if you went to the Altamont Springs Imaging Center, it's $28. So if you, again, had a $500 or $1,000 deductible just by using this website, and they also have an 800 number that they use. Their whole campaign for this is called Know Before You Go, but again, it lets you either call the 800 number to click on there, or you can even go into one of their Florida Blue centers and compare the costs. And this is not just Aetna or Florida Blue that has this. United Healthcare has a cost estimator. AvMed has a general cost estimator. Cigna has one. But once we go from the cost of care, you want to make sure that you're getting the best quality of care, because even if it's the cheapest x-ray, or, you know, let's say you're having something more invasive like, you know, a carpal tunnel surgery correction or ankle correction, or you're going to get a hip replacement. I mean, you want to know that you're at the best facility for that, and sometimes the cost of the care is not as important as the quality of the care. And each individual health insurance company typically has some quality care comparisons, but one of the best websites for this is Medicare. And Medicare.gov, any kind of medical providers, especially hospitals, have surveys that they have to give all of their patients. And so they collect all this information, and they use this to basically compile a very nice quality of care estimator. Let me show you. This is the Medicare.gov website, and this is where they let you look at hospitals. So you would just put in your zip code, and you can look at a specific hospital, and it's going to give you general information about the hospital. It's going to tell you the results of the surveys, and this has to do with the nurses, the doctors, the food. I mean, it goes into just everything, and it tells you whether they're above average or they're below average. It's going to go into timely and effective care, so you can go into a specific type of treatment and find out if the people had to return too quickly, how long things took, as far as I mean, it just has pages of different types of treatments that are at the hospitals, and where they compare to the national average. So this goes into deaths and complications, medical imaging, and a number of different kind of things. So some of this has to do specifically with Medicare, but this website really is one of the best resources we have for looking at quality of care, not just for Medicare patients. E-Visits and Teledoc, and how to save money not only on your out-of-pocket costs, but also on your productivity.
Thanks, Carrie. I think the quality of care comparison you just showed us was really, really fascinating. And it's probably something that a lot of our members don't know about, as well as those staff members that are on these group health plans. So that's definitely something that everybody needs to really be aware of. Okay, E-Visits and Teledoc. So a lot of carriers are realizing that some of the things could be easily diagnosed over the phone or internet. So what they're doing is they're offering these visits either by telephone or over the internet. And it can save a lot of money and time. So if your health provider offers these types of these visits, you pay the office copay. It could save you the time. It's really ideal for those non-emergency situations that are, your typical earaches. Maybe it's pink eye or it's cold or sinus, something that your doctor knows you have a history of, and it's something that can be routinely done over the telephone or internet. What it does, it gives you 24/7 access to a national network of board-certified doctors. So the example that we're showing you now from Aetna, that's what you can expect. And again, it's ideal for those non-emergency issues, and it saves the time. And oftentimes your copay will be considerably less than if you were to visit an urgent care center or your local emergency room, which unfortunately some people are still seeking care at those types of facilities. Not to mention that nobody wants to sit in line or sit in your doctor's office when you either could be at home in the comfort of your home, or if you're able to work, you won't have to miss time out of work. Now, some other discounts that most health carriers make available to their members are wellness programs, health coaching, gym memberships. I know in Tallahassee, the big health company CHP will reimburse you up to $200 towards a gym membership. If you prove to them that you've joined a gym and that you're going there monthly, they'll reimburse you. And so this is becoming more and more the norm, even with companies like Florida Blue, Aetna. So check into that. E-diets, tips on nutrition. And again, there's more tools available from your health carriers to make smarter shopping decisions, whether it's on laser surgery, eyeglass frames, hearing aids. So, we really encourage you guys to use these tools and make sure your staff is aware of them as well. They are out there. Sherry?
Yes. In fact, almost every single website carrier has some kind of discount program, whether it be Jenny Craig, Weight Watchers, coaching tools. They'll go over different health benefits if you're diabetic, if you want to quit smoking. So what I have done here is have a link in the middle of the page that has almost every single one of the health carriers that we sell, and just a link to the different tools that they have. So I listed the My Aetna and the Florida Blue and My UHC, and it just depends on what your carrier is, as well as the different health assessments that are available to you. So I'm going to go ahead and leave these up in the middle of the page, but we are at 20 minutes, and that's the length that we had scheduled this webinar for. We really don't want to take too much of your time. So if anybody has any questions,